report found Tennessee answers 89% of calls made to the 988 crisis hotline. Now, it's a strong response, according to the mental health advocacy group Inseparable. But the organization and advocates say the state still needs to do more. State Capitol reporter Tori Gessner explains.
In times of a mental health crisis, the sound of a ringing phone can be a lifeline. Some in Tennessee are finding it through 988. A report by the mental health advocacy group Inseparable says Tennessee centers answered 89% of those calls into 988 in state, while the rest were fed out to overflow call centers.
In July of 2021, Tennessee actually had a 74% in-state answer rate. Today, 89%. That's a huge increase.
While Tennessee shows promising strides, the report also highlights the need for other mental health services in the state. Inseparable calling for over 50 total mobile response teams, mental health first responders designed to meet people in times of crisis where they are. Plus, close to 700 short and longer-term crisis stabilization chairs and beds, where people can voluntarily go to get connected with services. Elliot Pinsley, CEO of the Behavioral Health Foundation, says the state has these services in place, but the Department of Mental Health hasn't publicly released how many, and improvements can be made.
We have one-person mobile crisis teams largely in Tennessee. When we send out a single person, it's very difficult to expect that that person is going to enter the home and assess somebody who's in a crisis without first having to call for, say, law enforcement to check out the scene first. That's not exactly what we want.
Despite that, Pinsley says Tennessee is making good investments, with 9 total crisis stabilization units and 3 more on the way.
And the state's credit, they have put their money where their mouth is in a big way and have added a significant amount more funding for mental health crisis services. There can be a lot more investment to really make things better for folks.
Inseparable says the state could better fund mental health services by passing a law to charge cell phone users a 988 fee, generating an estimated $6.8 million a year.
The main goal of this report was to really educate lawmakers about what an effective mental health crisis system looks like and where states are at.
Reporting in Nashville, I'm Tori Gessner.
Well, last session, Democrats sponsored a bill that would have enacted a 988 fee, which is allowed by federal law, but it was quickly killed.